So like I said, welcome. The first thing that we're going to go over is the husbandry video. I had sent everybody the Soldier's Best Friend husbandry exam. This video will help you to complete the exam, as well as the handler's manual. It'll have all of the answers and everything in it for you. I am going to put a deadline on getting the husbandry exam back to me. That deadline is going to be next Saturday, January 29th. You can send it directly to my email, which is paige, P-A-I-G-E, @soldiersbestfriend.org. If you have any questions regarding the Zoom introductory classes, you can, or onboarding, or just any questions about the program, you can email me. And if it's not something that I can directly answer for you, I'll be able to point you in the direction of the person that can. And then, of course, I'll send an email after this to all of the participants to recap anything that I'm saying. So don't feel the need to write down deadlines. Don't feel stressed. This is supposed to be fun. So let's go ahead and get started. We're going to go ahead and watch the husbandry exam, or the husbandry video. It's about 15 minutes. So we'll get started there, and then we'll take a quick question break. Sorry, give me 1 second.
Let me introduce myself. I'm Dr. Steve Dow. I'm a veterinarian. I live in Prescott. I'm also a veteran that served in Vietnam, and Woody here.
I think you lost the sound.
Best friend. What we want to accomplish today is making you comfortable with your canine companion. Leslie, who is our senior trainer, has put together a pamphlet on the wellness exam. And by a wellness check, what we mean is just going through the basic parameters of a physical exam, of which we will do. And you want to do that weekly. She has that in your binder so that you get used to handling your dog and knowing what's normal. I think that's probably the biggest thing. There are a number of books written that I would recommend for anybody that has a dog that is part of Soldier's Best Friend program. There's Dogs of War. There's probably the most famous book is called Tuesday's Promise, and or any of these books kind of help you relate to your dog. And that's what we want to accomplish today. I'm going to just do a brief physical exam, and Damien is going to help me with this. Woody, as you can see, is a pretty good patient. So in your pamphlet, you have this wellness check. And the wellness check is basically going through all the different systems, both that humans have and our canine buddies do too. So we always start with, and we're not trying to make you veterinarians. We just want to make you comfortable with your buddy. And we don't want to go overboard with this thing, but you need to know what's normal. And that's the idea of this weekly wellness check, of going through your dog and knowing what's normal for your dog, and then you will subsequently learn what is abnormal. So I usually always start at the head, and that's just the better end to work with. Let them be comfortable with you. You can do this on the floor, you can do this on the table, you can do it wherever you're comfortable with him. And so what you do is you just want to get a hold of their head and, you know, let them know that, hey, this is fun. You know, we just want to take a look. And you can see Woody gets pretty stressed out here. and he likes his head rubbed. And I always just kind of lift up their gums, and we always want to look in their mouth. We can pull their mouth apart, look down in there. Is any abnormal odor? What do the teeth look like? Are they clean? Are they have tartar on them? Or are there any growth on the gums or within the mouth? How's the tongue look? And some of the initial exam that you're going to be doing on your dog, the dog may question you a little bit, but again, it's a time of positive reinforcements for both of you. So the first one on your wellness sheet is heart rate and breathing. Well, first thing, and if a dog is going to be breathing normally, you want to make sure their nostrils are clear. Some dogs can actually get involution of these nostrils. The other thing here, you want to make sure that both apertures are good for the nose. And at the same time, that's why you can also look at the teeth. The next thing that we do is, and you can use a flashlight at home, is you want to check the eyes. You want to sit up here, Woody, so you can, let's get him up. There you go. We want him sitting up here like this, and then we can look at his eyes. So we roll back his lids, top and bottom, making sure that his eye looks normal. Their eyes are just like ours. You don't want to put anything in them that you wouldn't put in your own, and you expect to see that white part of their eye. It should be white. And if you're at home and you want to see how the eye actually looks, you can just shine a flashlight either from the side like that, or just right down in it, and you'll see it's called a pupillary light reflex. That pupil should shrink down. Again, these are just basic things that we're working on. For you as your canine companion, what you want to do is lift up these ear flaps. You want to be able to look and actually smell that ear canal, see what's down there.
There you are.
You have to have a specific cone to look down in the ear, but you at home can actually just kind of put your finger in that ear canal, kind of massage it. If there's any pain or the dog whines, then there may be other problems that you're going to need to see your veterinarian about. So that's the ears. You can see they have a little bit of dirt on the outside, doing some hiking. And just check that out again. Smell, get your fingers down in there, get your dog used to being handled so that they know and they can tell you if there's a problem. There may be whine, or if you see anything abnormal, then that's the time to maybe get to go see your veterinarian. If you were to get on all fours, anatomically, your heart would be in the same place as the dog's. So his heart's going to be right here in this, right behind the left leg. And you can actually just kind of put your hand next to it. Now, as a veterinarian, we use a stethoscope. But again, I'm not trying to elevate you to a level of a veterinarian, but you need to know what a normal pulse rate is. And the normal pulse rate on a dog is about 120, when they're anywhere actually from 90 to 130 is pretty normal. So again, what I do is I always try to listen and make sure that the heart sounds good, it's regular, and it doesn't have any arrhythmias or missed beats. You can, again, with your dog, should be able to go ahead and put your hand on that chest, and you can actually feel that. And it's always a good thing to do, to roll around with your dog too, and just get him confident that you're not going to hurt him at all. So now we're moving our way back. We know that he's got a heartbeat, it's regular, his mouth is not putting out any bad odors. So we're moving on back, and we're keeping our hands on him so that we can feel any lumps or bumps that would show up. The hair coat is something that Woody sheds a lot. He's a Labrador, so they shed a lot. And certain breeds of dogs and certain dogs shed more than others. That's not a abnormal finding by any matter of means. Sometimes the hair coat gets dry, and you can work with your trainer too if there's any issues you think about diet or the skin is real dry. So the next thing that we're going to do is we're going to come back here. We're going to check the tail area. You probably heard a lot about anal glands and taking their temperatures. It's something that you should know how to do. And what we use is just the human thermometers, and we take them rectally. You probably heard that they have otoscopic thermometers as well, but they are not as accurate because of the structure of the ear canal. So what I try to do is, you let them know what's going on back here. And so I just raise their tail and insert the thermometer into the rectum, and then you wait for the beep. I know that some of the dogs get a little embarrassed by it, but it's an important factor. If there's one thing that you should know how to do is to take their temperature, because if you think that they're not eating and things aren't going right, first thing that your veterinarian is going to want to know is what's the temperature. So, and then at the same time, we'll look back here. They have 2 glands on each side of the anus. Those are called anal glands. The function that they do is really just kind of marking their territory. They can get plugged up. They can get abscessed. They can have numerous problems. So if you see your dog licking a lot or scooting, the anal glands may need to be addressed. Now, dogs will periodically vomit, periodically have diarrhea. It's not an emergency. If it's a persistent vomiting or diarrhea, then it needs to be dealt with. Vomiting probably more acutely than the diarrhea. The vomiting that occurs in dogs is just part of their nature oftentimes. But if it persists for more than a couple of days, or this dog, you see a swelling in the abdomen and the dog's getting very painful, then that could become an emergency. One of the things about it that you have to get comfortable with is what is an emergency on a dog. Well, an emergency is very uncommon. If a dog has diarrhea for a day or two and there's no blood or anything in it, it's probably just something that the dog got into. Hopefully you're going to be able to prevent those things that happen. Woody would grab anything on the trail and carry it around. So examining the feces is always a good idea. As we talked about, there's anal glands back there, but the feces, if they get loose, that's not really any big thing. If you're starting to see mucus or blood after a day or two, then that becomes important to contact your veterinarian. But it is not truly an emergency. The emergency would arise more from the other end of vomiting if they have an obstruction in their GI tract. And again, if they vomit once or twice, that should not be a problem. You can report the finding to your trainer and, if need be, your veterinarian. And looking back, I think it's very important that you establish a relationship with a veterinarian that's nearby you. We have a list of hospitals that give a discount to Soldier's Best Friend. One of the unique things about Soldier's Best Friend, and what I am definitely an advocate for, is that this training that you're going to go through is with the dog. Most of these veterans organizations will hook up people with a dog, but they also want a $3,000, $5,000 fee for that dog being already trained. with myself going through the program and seeing what other veterans in the program have done, it's just been a tremendous growth for both of them. So again, it's Soldiers Best Friends unique because we train together, and during that training time is how we get the bond that forms that you'll never regret having.
All righty, does anybody have any questions about the video that we just watched? You can shake your head up or down if you don't want to turn your mic on. Excellent. We are going to quickly go ahead and go through the handler's manual with respect to how to give your dog an in-home check. I know it's explicit, but I want to make sure that you all know exactly what page everything is on.
Okay,
Tell her you never got one.
I never got one. One what?
The handler's manual.
Not yet.
Not yet.
I'll resend it to all of the attendees after we're done with this as well, to make sure everybody has a copy. You will use your handler's manual often.
Is there a way, can you hear me?
Yeah.
Is there a way to get a hard copy of this?
You will get a hard copy when you begin training. Absolutely.
Okay, good, because it's hard to read for me.
Portions in the handler's manual that you'll have to fill out, like the weekly training logs and the weekly wellness checks that your trainers will check, and it's exponentially more easy to have the hard copy. So we do provide that for you.
Right on. Thank you.
Of course. But I will resend the handler's manual and the Soldier's Best Friend husbandry exam at the end of this, just to make sure that everybody has it. Welcome to those of you who kind of popped on a couple of minutes later. The Zoom introductory classes has a required component of completing the husbandry exam. I will send that to you all again after this. I am giving it a deadline for you to get it back to me by next Saturday, January 29th, directly to my email, which is paige@soldiersbestfriend.org. We can't really move forward with anything else in the program, like temperament testing your existing dog or pairing you with a Soldier's Best Friend dog, until we have received that husbandry exam. And then, yes, I can also send that video that you all just watched to your emails as well. This entire recording will also get to your emails. So you'll just get a big email of all of the things. Awesome. So let me go ahead and share my screen back again. Alrighty, so this is the handler's manual that I had sent you. And like I said, you will receive a hard copy. However, we're just gonna go through the various portions of the handler's manual. Like I said, everything in the Soldier's Best Friend husbandry exam that's due next week is actually, you can find it in the handler's manual. So, I know he went over this in the video. We're just gonna recap a little bit, just briefly here. This is the veterinary portion of the handler's manual, and it can be found on roughly page 45 to 70. I think that your copies may be slightly different than mine. I have a couple of extra pages, but it's roughly 45 to 70. There are 5 vital checks that you should be able to perform at home and then record in the weekly wellness check portion of your handler's manual during training. Those 5 vital checks are pulse, respiration, temperature, capillary refill time, and hydration. Pulse is super easy to take, even if you're not a veterinarian. I know most of us don't have a stethoscope at home, but what you can do is place the ball of, let me scroll down a little bit for you, place the ball of your 2 fingers on the depression found in the animal's upper inner thigh over the femoral artery, and there's a photo for you. And then count the beat for 60 seconds or for 30 seconds, then multiply by 2, of course, and that will give you their heart rate. It provides you a nice little table of what the average heart rate for your size dog should be. The next one is respiration, which of course is the process of inhaling and exhaling / breathing. You would basically count the breaths, the rises and falls for 60 seconds of as your dog's chest rises or falls, of course. And then of course, there's another little table in here for you. This is just to ensure that they're not panting, overheating, they don't have anything going on behaviorally. Oftentimes dogs will start panting if they're stressed. So this is kind of something that will play both into a medical portion as well as a behavior portion. Temperature is also incredibly important. As he mentioned, if your dog needs to go to the veterinarian for any reason, this is one of the first questions your veterinarian will ask you. A temperature over 103 is considered a fever, and a temperature over 104 is considered an emergency. We do have a protocol when you suspect that your dog is having an emergency. If it's a Soldier's Best Friend owned animal, we do, for regular visits, we do require that you go to one of our partner veterinarians. However, depending on how emergent the situation is, you may not live close to one of our partner veterinarians, or they might not be open. So we simply request that you reach out to Danae, who is our adoptions and foster specialist, or Latia, who is our programs manager, just to let them know it's 1 a.m. and I know you're not going to answer the phone. However, my dog is having a very serious emergent situation. Oftentimes, the things that we consider emergent are going to be trauma, trauma to the head, chest, or abdomen, which of course is going to be like a car accident or something like that, a seizure, bleeding for whatever reason, like excessive bleeding, fractures or suspected muscle / tendon strains, superficial wounds that are more than 1 inch in length, shock, respiratory distress, inability to walk, bloat. Often those things are what we consider to be emergent, and you should seek emergency veterinary care in those cases. For routine exams, moderate diarrhea, moderate vomiting, those are considered to be non-emergent, and we will connect you with a veterinarian to schedule an appointment for you. Capillary refill time sounds confusing, but it's not. Basically, just ensuring that the blood and oxygen is moving through your dog's body appropriately. All you have to do in this scenario is lift their gums and press your thumb on their gums. Releasing pressure should result in the color or the blood returning to the gums within 1 to 2 seconds. If it takes longer than that, we need to start to consider increasing the circulation, and veterinary help would probably be the go-to for that scenario. Lastly is hydration. We want to make sure that our animals are not dehydrated, especially in Arizona where it gets so hot. We want to make sure that our animals are properly watered. So to do this is just pinching their skin. We test their skin turgor. You pinch their skin and determine the amount of time that it takes for the skin to fall. If it falls quickly, that means that they're hydrated. If the skin remains tented, it means that they are not. In those cases, you may want to consider getting your dog some more water. If your dog continues to not drink, that would be a veterinary concern. And then of course, the regular things that he went over that you want to check often are nose, eyes, ears, mouth, and their skin and body. We want to make sure they don't have any ticks. We want to make sure they don't have any fleas, things like that. All of our animals are provided with NexGard flea and tick prevention. So you shouldn't have an issue with that. However, it's always good to check, especially if you're active with your pet and you go hiking. Does anybody have any questions thus far about anything veterinary related? Yes. Sorry, I think that you're muted and I can't figure out how to unmute you on my end. Sorry, I don't know if you can hear me, but you're muted. I'm not sure if you can unmute me on your end, Tim.
Can
There
you
you
hear
go.
me now?
Yes.
Okay, there we go. I don't know what it was. Down here in Sierra Vista, we don't have any of the places that are listed as the primary care hospitals,
Right.
but we do have a VCA Apache, like the Veterinary Center of America that
Mhm.
they have up there in Mesa. Does our VCA Apache fall under the VCA there in Mesa?
So I want to say that the answer to that is likely yes. However, since you're in one of the outer regions, I'm going to actually connect you with Danae. She's our adoptions and foster coordinator. She also handles all veterinary care so that we can provide you with absolutely the correct veterinarian to go to down in Sierra Vista.
Okay, thank you.
Yeah, of course. Just writing that down really quickly. Does anybody else have any other questions before we move on to the next portion of the handler's manual?
I'm good.
Excellent. So then let me go ahead and share my screen again. We're going to go ahead and jump back up to roughly page 17. Sorry if this is dizzying. Let me see what page it is for you guys. Yeah, page 17, bringing your new dog home. I'm sure that a lot of you have owned pets in the past, but it's always a nice little refresher to discuss how to bring your dog home, kind of the things that you should be aware of when you do so, especially if it's a soldier's best friend provided animal, it came from the shelter. So oftentimes, how we assess our animals behaviorally is to determine if they have any handling sensitivities, if they would be a good fit for service work. However, as they come from a shelter, we really don't know much about their background otherwise. We don't know if they are potty trained. We don't know, if they're door dashers, if they already know some basic obedience. We do place our shelter dogs into foster prior to providing them to you. So the foster is able to give us a little bit more information and work with them prior to you receiving that dog. However, there are just simply some things that we're not going to be able to know. Unfortunately, the dogs can't tell us. So that's something to be aware of. I like to go based off of the 3-3-3 rule. It's 3 days, 3 weeks, 3 months. Basically, what it implies is that within the first 3 days, the dog that you bring home is very likely not going to be their true self. They're probably a little nervous. They may be a little bit more shut down. You are a new human to them. They are a new animal to you. Your house is new. Your yard or your patio or whatever you may have is completely new to them. So they may not know the right areas to go potty or how to ask to go outside. So the first 3 days are really critical in just making sure that they feel comfortable and reassured by you. As you move into further time with your dog, the 3 weeks is really when your dog starts to come out of your shell or out of their shell. And that's going to be the critical training bonding moment for you. They may still not be 100% comfortable or 100% confident, but training, especially with Soldiers Best Friends, as we're a positive reinforcement-based training facility only, it's tons of reassurance, it's tons of affection and attention, tons of praise. Those 3 weeks are going to be critical for bonding, getting to know one another, really going over what the dog already does know as far as basic obedience goes. And then, of course, by the 3-month-ish mark, the dog has really come out of its shell. You can really see their personality. They're probably more comfortable with you in their home, but it does have, the whole process really has a lot to do with patience, both from you, as well as for them. But of course, as the human, we cater to them more than they cater to us, of course, as far as making them feel comfortable and reassured, especially in a new environment. Does anybody have any questions about kind of the 3-3-3 rule or estimated timeframes? Let me go ahead and scroll down here. Excellent. And of course, that's all going to be an estimate. Every animal is an individual. They're all different. A dog may come out of their shell as soon as you bring them home, happy-go-lucky dog. Another dog may need a little bit of extra reassurance. So every dog is a little bit different, but of course we go above and beyond to pair you with the perfect match for you. To go back to the handler's manual, tons of information in here about how to bring your dog home. This background portion kind of does go over, we may or may not know everything there is to know about the dog. But of course, like I said, they do go into foster prior to being paired with you to get a little bit more information. If you have any other animals at home, we do provide you with a little bit of a how-to for what to do to introduce them. However, Soldier's Best Friend, your trainer, myself, we are more than happy to assist with an on-site dog introduction if you have existing pets. We want to make sure that both your existing dog and the dog that we are pairing you with are going to be comfortable in the same home. So with that being said, we can absolutely help to introduce your dog on site at Soldier's Best Friend to make sure that it's kosher prior to you bringing them home. We don't want any mishaps or any issues. We want to make this as smooth a transition both for you, your existing pet, and the dog that you're bringing home. So we're more than happy to help with that. However, there is this brief how-to here. And then of course, it just goes over some general safety guidelines. Like I said, we don't know if your dog is going to be a door dasher. We don't know if we typically don't know if they like to pick items up when they're out on a walk and ingest them. Your foster, the foster that your dog goes home with first will be able to provide us with a little bit more information, but everything is a learning experience. Essentially, like this says, it's critical to pay close attention to where the dog is, what they're doing, what they're putting in their mouth, what you leave out in your home. We want to set the dog up for success, and so we want to make sure that they're as safe as possible, and the only way that they can be safe as possible is if we as humans set them up for that. I do want to discuss heat safety. We live in Arizona. It gets incredibly hot here. I love this little pictograph. It discusses if the temperature is X outside, then the temperature is Y on the asphalt. So you can kind of come to expect that if it's like 90 degrees outside, the temperature on their feet is going to be about 150. And after only a couple of steps, that can be incredibly painful. We do provide you with boots, whether you live in one of the outer regions where maybe I know up north it snows, or if you live in one of our more central locations, boots are excellent to protect their feet either in the snow or the cold as well as on the hot asphalt. So we do make it a requirement that they are wearing boots for their evaluations if the temperature is between a range that we provide to you. So it's always good to get them familiar with wearing them, putting them on, taking them off. But of course, it really just comes down more so to ensuring that they're comfortable and healthy and safe. We discussed some potty training in here. I think mine is a little bit different than yours. Potty training, how to go over that. Is going to be taking them out often, making sure that they know the right place to go, giving them a treat and praise and reward every time they go in the correct spot. I strongly recommend that you don't punish a dog if they have accidents in the house. A dog has about a 1 to 2 second attention span for associating a behavior with either a punishment or a reward. So if you're not home and the dog goes potty 2 hours ago and you come home and you punish it, there's no way for the dog to be able to associate that it's being punished for going potty. They don't have that long of an association period. What the better option to do is to take them outside. If they go potty in the right area, you reward them immediately, either with praise or with treats or pets and attention. And that way, they'll learn a little bit faster how to what you're looking for as far as what that location is. Like I said, they have about a 1 to 2 second attention span, so it's ideal to praise them immediately. Exercise, super quick and easy. All dogs need exercise. Oftentimes, for some dogs, playing in the backyard is enough. For other dogs, they'll require, if they're higher energy, they will require a hike or a very long walk. So it's kind of dependent on the activity level of your dog and your activity level too, of course. But all dogs need exercise. This is a really interesting fact. A study by the University of London found that dogs who engage in playtime after a training session actually retain that information more quickly. So we always want to make sure that our training sessions are fun and exciting for you and for the dog. But of course, keeping it relaxed afterwards and playing a quick game of fetch or tug will actually help them to retain the information better. Going over crate training quickly, your trainer will help you with the specifics of this, especially if your dog is not familiar with a crate or if they're having any issues. But essentially, even if you don't crate your dog at home for whatever reason, which is totally okay, one of my dogs does not get crated, they still have situations, they still may encounter situations where they should be in a crate. These situations include going to the veterinarian if you ever have to travel with them, and that ends up being the safer choice. So going in and out of a crate and tolerating it for a period of time is definitely going to be something that you want to train your dog to do, even if you don't end up crate training them in the home. And like I said, if you do end up crate training them in the home, of course, your trainer will be able to help you out with that easily. I did want to quickly touch on creating a routine. Like I said, all of the dogs that we provide to you are going to be shelter dogs, and the quickest way to create a bonding experience and to allow them to become familiar with your home is to create a routine. It really gives them something to expect, or it makes them feel more comfortable in knowing what might happen next. So that means that bringing your new dog home might look like feeding them at the exact same time every morning, immediately going potty, going on a walk at the exact same time every day, doing a training session, doing dinner, going on another potty walk, taking them on another potty walk right before bed, and really doing it about the same time every day. It helps the dog to feel like it has a little bit more consistency, and then it reduces anxiety and stress for them if they kind of have an idea of what to expect regularly with you. That being said, of course, life happens. We don't expect you to not work through this program. We don't expect you to not have events through this program. So we obviously recognize that there are going to be days that are slightly different, weeks that are slightly different. The routine really is just important, especially when you bring them home. It really helps to establish a bond with your dog, of course, and then it helps them to feel a little bit more confident. Does anybody have any questions about bringing a dog home? I'm looking, scrolling through you guys for head shakes. Thank you. Excellent. The next thing that we're going to discuss is the 5 service dog skills that every service dog should start with. You're going to be able to find this roughly on page 29. Let me scroll this down here for you. Training at a glance. So the first thing that I actually wanted to touch on is from the human aspect, 6 ways that you can be a good dog training student. It's really, really easy to feel like you know your dog and you know better almost, but I encourage you all to be open-minded throughout this program. Excuse me, all of our trainers are amazing and super knowledgeable, and they want to help you. So the first point is listen and be open-minded. Be ready to change. You know, sometimes the dog offers a different behavior, and you may not know how to handle it in the home. And your trainer will have a couple of ideas for you. Like this says, it's crucial to be open to new ideas and techniques. That being said, Soldier's Best Friend is a positive reinforcement-based training facility only, which means that we do not use punishment. We do not use aversive tools. We do not use prong collars, choke chains, e-collars for training. If you want more information on why we don't use those tools, you can email me. I love discussing positive reinforcement-based training techniques, but rest assured that everything that we do is going to assist you with the dog in a positive way. So be open-minded. Ask a ton of questions. If you're confused, say so. If we don't know the answer, we'll work with you to find the answer. There is no such thing as a dumb question. And all of our trainers will either clarify with you what the answer is or work with you to find the answer and what works best for you, your lifestyle, your home, and your dog. The next point is try it, you might like it. Even if you don't think it'll work, if there's no harm in trying, especially because we are positive reinforcement based, why not try? Excuse me. It's unfortunate that dogs can't tell us exactly what they need or exactly what will work for them. However, they can with some body language, of course. And so that being said, whatever we try is kind of like it might work for your dog, it might not, but if there's no harm in trying it, there's no harm in seeing what the outcome could be. Oftentimes dogs will respond in ways that we don't predict. So try it, you might like it. Point 4 is don't be defensive about your dog. We know that you love them. We know that you know them better than your trainer does. But if your dog is doing something inappropriate, there's no reason to defend the behavior or justify the behavior. We want to be able to work with you through it. So, don't be embarrassed, don't be defensive. We want your dogs to succeed in the program. We want you guys to succeed in the program. So as soon as we can all get on the same page and be open-minded, open to new discussions, then, the quicker your dog will be able to succeed. This point is probably one of the more important ones. Take responsibility for your dog. If your dog is not progressing, there is a reason, and it's most likely you. We do require that you train with one of our Soldier's Best Friend trainers twice a week. Those training sessions are 1 hour each. However, your dog is not going to succeed in the program if the training sessions are, if that's all you're doing with the dog. Training is 7 days a week. Training is ongoing. That doesn't necessarily mean that you're literally doing sit-stay training every second of every day. However, it does mean that you are creating boundaries with your dog. You are reinforcing appropriate behaviors. You're taking them out and about. Once you pass, certain milestones in the training, they're going with you to become more comfortable with various environments. Even a walk is a training experience. But the main point to take away from this is that if you aren't training with your dog often, or if you're expecting your dog to succeed based only on the 2 training sessions a week, it's not going to happen, or it's not going to happen in the time frame that you expect it to. So work with your dog. It really helps to increase the bonding experience, and take ownership of how often you do work with them. And that kind of bleeds into point number 6, of course. Put in the work. Dog training takes time and patience. Like I said, it doesn't happen overnight, and there's no quick fixes. There's no training fairies, but your dog will get there if you put in the work with your dog. Your trainers are always happy to help. We're happy to provide all of the insight in the world that we possibly can, but most of the training is going to happen with you and your dog at home alone, or not alone, but at home between the 2 of you. Does anybody have any questions about those 6 points? Excellent. I think if you are talking, I can't hear you. Sorry. If you have a question, please be sure to unmute yourself prior. Or if you're muted and talking to other people, that's fine too. I'm just making observations. Awesome. So we're going to go ahead and move right into the first 5 service dog and training skills. The first one is going to be a marker. This is either a word or a clicker or a sound that marks that the dog is doing the behavior appropriately. The way that you would condition this marker is to begin by just saying whatever it is or making the sound, and give a treat immediately. Like I said, there's about a 1 to 2 second attention span. So say the word, wait for the dog to look at you, give it a treat. Eventually you will be able to, eventually meaning after some significant time, you will be able to phase the actual treat out. And the dog will come to be conditioned to the word or the clicker or the sound being the reward itself. They will come to expect it when they're doing a good job. And it's incredibly important to do this very early on, because as you work through the program, there are a couple of evaluations and milestones that you have to complete and succeed in. And the difficulty level increases in the sense that as the evaluations go on, you are allowed to use less and less and less treats. So you always want to make sure that you have a word that can be conditioned to be associated as the treat, essentially, especially for those evaluations. Their name is going to be obviously something that they should know. The way that you basically train this, there's this whole section here, but you say their name, you wait for them to look at you, you give them a treat immediately. You do it over and over and over and over until you can say their name from across the room, and then you can say their name from across the backyard. A name is, the dog doesn't know that their name is Johnny. They don't know that their name is Bones. Like, they have no idea. They only recognize their name as just another command that essentially means look at me or come to me, or focus. So increasing the distance between how far you can get your dog to focus on you when you say their name, the distractions that are around is super important. My recommendation, of course, would be to start in your living room and make sure that every time you say their name, they look at you, you give them a treat, you reinforce it. Over time, your dog will come to associate that command with them looking at you.
I got a quick question.
Yeah.
Up here when it says rabbit full bowl, this is his meal time, so used to what he's regularly get. What if you free feed? You
So
just leave.
we strongly recommend not free feeding. There are a couple of reasons for that. The main one being that the dog, you as the human can use mealtime as a training opportunity. Literally every single one of their kibbles can be used as a treat. So if you ask the dog to sit, you give them one of their kibbles. And then you do it over and over and over, and that's how they get their meal. Obviously, that is time consuming, and we don't expect you to do it every single mealtime, but you can start to use it as a training opportunity. Another reason that we recommend not free feeding and feeding twice a day instead, there's medical benefits to it, including you can see how much your dog is ingesting. And so if they are gaining a lot of weight or losing a lot of weight, we can really identify how much food they're getting and help you to determine if it's a medical problem, if we simply need to increase or decrease their food. We use a ton of treats at Soldier's Best Friend. So oftentimes what we recommend is that you cut the portion of your food that you're feeding them in the morning and at night by about 1/4 of a cup to start, because of how many treats we give them throughout the day. But then again, you can really see how much the dog is ingesting and adjust from there. But for me personally, I recommend feeding twice a day as a training opportunity. It'll really, 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 really help because feeding is such a strong positive reinforcer. They're already hungry. They're already willing to work. It really helps with training. If you have a preference for free feeding, we're certainly not telling you that you can't. That can be something that you discuss a little bit more in detail with the trainer that's assigned to you, so that you can determine what's best for, like I said, you, your lifestyle, the dog, your training, etc. Make sense?
Yes, ma'am. Thank you.
Of course. Something that's really, really super important for service dog training is going to be settling quietly for a long period. Oftentimes when we think about dog training, we think of the basic obedience. For service dogs, we think of tasks, we think sit, stay. Something that goes not unnoticed but unrecognized often is your service dog is doing nothing a lot of the time. They are laying quietly below your feet at a restaurant. They are sitting patiently next to you on a bus. They're not really given a task to do or a command to show. Oftentimes what they're doing is just being next to you. And one of the main qualities of a service dog is that they need to be able to do that calmly. They need to be able to do that quietly.
They unmuted.
So one of the ways that we can do that is by tethering your dog to you. That's hooking the leash around your waist so that you have room to move comfortably. The dog has room to move comfortably, but they don't have a ton of room to go out and get into trouble around the house. This will basically allow your dog to discover which position they're most comfortable in, the position that you are consistently rewarding them for. And then it'll over time be able to allow them to readily offer that behavior for you. What you can do to start is provide them with something that is enriching and time consuming for them. So something like a Kong or something like a Nylabone or something like a peanut butter stuffed trachea or whatever you may need to allow them to understand, like, oh, okay, when I'm with mom or when I'm with dad, I'm just laying here calmly. Over time, like any other treat, you can start to phase out the bone or phase out the Kong and just expect that they will lay patiently with you. This takes a ton of patience on the human end. This is certainly not something that is accomplished overnight, and it is something that's really phased into the training every day. It's something that your dog will learn with time, but it definitely requires some patience from us. One way that I really like to teach this command is by also providing a place command. when you're expecting the dog to lay quietly next to you, there's not really a command to tell them other than lay down. I like to teach a place command. It really gives them an area where they feel safe in knowing that this is where I'm supposed to be until I'm released. And then, of course, you can phase out the actual place. The last two are probably my favorites, sit and loose leash walking. Sit is easily the obedience command that we will be using most often. It's the obedience command that your dog will be expected to do the most often, or perform, I should say. And it's a really, really easy one to teach. So I also like to use this command as a confidence booster to lead into teaching other commands. Essentially, how you would teach this command is putting a treat just at the tip of their nose, raising your hand back over their head, and as the dog's butt touches the floor, you provide the treat. You do that a couple of times after they've kind of begun to understand that the lure motion and the butt on the ground gets the treat. You can start to phase in the verbal command of sit, phase out the lure or the motion of your hand going up above their head. And with time, the dog will start to understand that the verbal command sit is what is getting the treat as soon as their butt hits the floor, instead of the lure. This is also done, this is the same technique. Luring is the same technique that we do with down. It's the same technique that we use for to train a dog to perform tasks. So not only is sit something that a dog should know almost right off the bat, but it's also the method of teaching the sit is ideal for us as the humans to be able to know, as well as it will assist us with teaching other commands in the future. Lastly, here we have loose leash walking. There's a couple of methods that you can teach a dog to stay in a heel or to walk loose leash. Loose leash walking is going to be a requirement for every evaluation that you perform. So there's a couple of ways to teach it. My favorite is holding a treat right in front of their nose directly at the side of your thigh, so that as you're walking, the dog is standing very closely next to you. They're following the treat. You go ahead and pop the treat in their mouth every couple of seconds. Similarly with heel, you start to phase in the word, or similarly with sit, you start to phase in the word heel and phase out that lure. There are other ways to teach loose leash walking, like allowing them to hit the end of the leash, recognizing that they will not get to pull forward if they're not right next to you, calling them back to you, getting them back into a loose leash walking position, and moving forward from there. That is a more, that method requires a little bit more patience on the human end, but because the dog is associating both the treat when they come back to you, as well as the quote unquote negative experience of them not being able to get to where they want to go, it's twofold, and they end up learning, in my experience, they end up learning heel a little bit faster that way. As with all of these techniques, all of these skills, your trainer will go over all of this in significantly more detail than I will. We just want to make sure that you have a really good understanding of what might be expected of you from the get-go. Does anybody have any questions about the 5 service dog in training skills or how you might teach them? Excellent. No questions then. Great. The last thing that we're going to go over is the ADA, American with Disabilities Act. This is going to be found directly after this section in your handler's manual on page 34. Here we go. So Service dogs are defined as dogs that are individually trained to work or perform tasks for people with disabilities. Disabilities can include post-traumatic stress disorder and traumatic brain injury, seeing impairment, hearing impairments, people that are diabetic, people that are prone to seizures, people that are in wheelchairs, etc. The dogs themselves are trained to alert their humans. They're trained to alert other humans in the event of a crisis. Every service dog is an individual that is trained for an individual, which is why our programs, almost so successful, is because the dog trains alongside you, with you. The dog is not trained to perform generic tasks and then they're provided to you. They are trained specifically for you. So that means that there can be different variances in how you give the command. There can be different variances in exactly what the dog is supposed to do. For example, one of my favorite tasks for those that become anxious in a large crowd is the dog is told orbit and walks out to the end of the leash and creates a large circle around the veteran to clear space in a crowd. That's probably one of my favorite tasks. It's impressive to see a dog do it for the first time. It's impressive how the dog is so willing to assist. But there can be variances in how far out the dog goes on the leash. If you want them to remain close to you while they orbit, what the actual command is. I have veterans that have taught their dogs circle, which is the exact same thing. But that's kind of one of the benefits to our program with you being with the service dog itself. You train the dog learns what you want it to do. It's not a generic process. Moving on for ADA, under the ADA, state and local governments, businesses, and nonprofit organizations that serve the public generally must allow service animals to accompany their human with disabilities in all areas of the facility where the public is normally allowed to go. That being said, they're not necessarily allowed to go every single place. For example, in a hospital, they may be able to visit patient rooms, clinics, cafeterias, or exam rooms. However, they may not be allowed in the operating room with you for sanitary reasons. So under the ADA, they are allowed in most places, but not necessarily all places. There is also kind of a bit of a stipulation on if you have a membership or a contract, so something like the gym or Petco, there needs to be something in that contract that states that you are allowed to have a service dog per the organization. Most places obviously are more than accommodating, but in the event that somewhere has a contract for you to enter, that contract also applies to your service dog as they are an extension of you. So they have to be in the contract as well. Your service animal must remain under control. Under the ADA, service animals must be harnessed, leashed, or tethered unless these devices interfere with the service animal's work or the individual's disability, which may prevent the use of those devices. In that case, the individual must maintain control of the animal through voice signal or other effective controls. If your dog is not under control, despite the fact that they may be allowed to be in any particular area, they may be asked to leave. So if they are in a public space that they are typically allowed to be at as your service animal covered under the ADA, if your dog is unruly for whatever reason, barking, lunging, growling, acting aggressively, if your dog is urinating or defecating indoors or in an area that they are otherwise not allowed to be urinating or defecating, they may be asked to leave. So I always tell our veterans to keep that in mind. Like you do have a right, an absolute right to defend yourself, especially if somebody is questioning if your dog is a service dog or what they are trained to do. That being said, If your dog is acting unruly, they are allowed to ask you to leave. There are only 2 questions that a staff member are allowed to ask you. These questions are, is this dog a service animal required because of a disability? And what work or task has the dog been trained to perform? They may not ask you what your disability is, and they may not ask you to show proof of said task. Your response is very simple if you are confronted in public. Yes, my dog is a service dog allowed under the Americans with Disabilities Act. They do X task, or they perform X command. Confrontation can be incredibly anxiety inducing. So as you are out in public, for the most part, you will be with your trainer. All of our trainers are also incredibly compassionate, and we will help to work you through any confrontations. But once you do graduate, you can expect that people are going to come up to you and ask why your dog is there. The sooner that you know the appropriate response to the question is, the sooner you'll feel more confident in providing that response. Does anybody have any questions about the Americans with Disabilities Act or anything else that I have gone over?
Raise your hand.
Go ahead.
How do we, when we go into a restaurant,
Mm-hmm.
how do we teach the dog? I mean,
So your trainer, the way that our program works is that there are milestones that we work through. We start with the very, very easy milestones, of course, to set your dog up for success. And as they are progressing in their training, we go to more difficult places. So
Okay.
you are accompanied by your trainer when going to restaurants. However, before that point, your trainer and you will have both felt comfortable with your dog being able to lay down under a table calmly. The dog knows the down position. They know how to go under a table. They know how to leave it, which means that if any food or anything drops, they don't walk towards it. So it's all kind of baby steps leading up to those more difficult experiences.
How long does it take?
yeah, okay, all right, thank you very much.
Yeah, of course. To answer her question in the background, our service dog program is 6 to 9 months, depending on the veteran, depending on the dog, depending on, of course, other factors. It may be slightly shorter, and it may be slightly longer. It takes 6 to 9 months for the service dog to get through the program as a baseline. However, it's often that it may take a little bit longer, just depending on the individual. It may take a little bit less time, depending on what commands the dog may have already known, etc. So about 6 to 9 months is my short answer.
Oh, good, thank you very much.
Does anybody else have any other questions for me? I know this was a lot of information to take in. Like I said, we used to do this in 4 different sessions. And now we're throwing it all at you at once. I hope that helps you to, it helps with scheduling as you were all able to attend this time. But I know that it's a ton of information. So if you have any questions or if you think of anything afterward, please email me. My phone number is, my email address is paige, Paige, @soldiersbestfriend.org. I will also resend out the Soldier's Best Friend husbandry exam, the handler's manual, the husbandry video that you all just watched, as well as this entire recording. So be on the lookout for an email that contains all of the information from me. And then just as a reminder, the husbandry exam that you will be receiving there are true and false questions, and there are short answer questions. All of the answers can be found in your handler's manual, and I'm going to request that you get that back to me via email by next Saturday, January 29th. Sound good for everybody? Awesome. Thank you for the head nods. Thank you for the thumbs up. Please email me if you have any further questions. I'm happy to answer them. And if I'm not the right person that is the right person to answer them, I will direct you in the, to the person that can. So let me know if you all need anything in the meantime as we get you through your temperament tests and as we get you paired up with a soldier's best friend dog. We're looking forward to having you guys in the program. Thank you so much.
Thank you.